Hello everyone, my name is Hannah Poulton and I'm a senior physiotherapist, scar therapist, acupuncturist, a mummy MOT practitioner, which means I can deliver postnatal assessments for ladies 6 weeks after they've given birth. I own HLP Therapy, which is based in Narborough in Leicester, and I have 2 clinics here offering exceptional services and a gold standard of care for every client that comes through our door. One of the many things that I offer here is scar therapy, and over the last couple of years I've really honed my skills in scar therapy to be able to treat a scar effectively and also to treat the whole person, not just their scar. So using a combination of different treatment modalities such as my physiotherapy, acupuncture, and of course those scar therapy treatment techniques, the hands-on treatment techniques, as well as trialing different devices and equipment to be able to help with the function and healing of that scar. But what is scar therapy, and also how can it help you? Well, scar therapy is a simple of gentle, light, massage-based techniques to help with the function and feeling of the scar. But what do we mean by function and feeling of a scar? Well, you will know yourself if you've had surgery or if you've had any kind of accident or trauma resulting in a scar, that sometimes your scar can feel tight and red and raised. It can feel like it's pulling, and also you can experience pain in other areas of your body. And why is this? Why could you feel pain elsewhere? Well, the simple fact is that through all our skin and through our bones, over our bones and through our muscles, we have like a sticky net called fascia, and some people call it tissue. But actually, this fascia connects the whole of our bodies together. So, for example, if you've had a C-section and the surgeon has very expertly made the C-section incision and also the incision in your uterus as well, and got the baby out and sewn those parts together to obviously protect and heal you and help you recover, that pulling of the skin together can actually pull on these fascial connections. And you have a big fascial connection down the front of your body from your chin to your pubic bone. You also have a big crossover of a fascial connection right underneath your tummy from hip to hip. So all that fascia around your whole body has been disrupted by this, for example, C-section surgery incision. So when they've pulled that C-section together and sewn it up, you can get this pulling of the fascia round your hips, round into your pelvic floor, round your back as well. And that's because of the fascial connections that your abdominal has round your body like a corset at the front, with your transverse and your rectus abdominis at the front. That corset-like structure that helps support you and keep you up, as well as the myriad of functions that the abdominals provide. But also, if you've been cut at the front, then your back takes a lot of that pressure to try and counteract the surgery that you've had at the front and the weakness that is sometimes caused. So scar therapy aims to almost release or break down that scar tissue with these simple, light, gentle, light touch therapy, massage-based techniques over and around the scar. Of course, it's far more complicated than that behind the scenes, but that is what you will feel if you came into clinic with me. You will feel me working on and around that scar. Of course, we can't get rid of the scar, and nothing can do that. The scar is what is holding you together. But what we can do is help with some of the feeling, the pain, the tightness that scarring can cause, using these gentle massage-based intricate techniques, and also some tools and equipment and little machines that can help release and help with that feeling of the scar. Of course, I never work in isolation when treating the scar. You will treat the whole person. And when you come into HLP therapy clinics and see me, not only will we look at your scar and how you came to have that scar, we'll look at the emotional attachments and connections with that scar. And if you're able to look or touch your scar, if you are able to engage in it. We will look at your deep breathing exercises depending on where the scar is, or we might look at your range of movement in the surrounding joints. So for example, if you've had a C-section, we'll go through all of that and check your breathing. If you've had a mastectomy scar, then we might check your range of movement in your shoulder, as well as your deep breathing, as well as everything else included in our comprehensive scar therapy assessments. So scar therapy seems very light and gentle, and it is, and it's very, very effective for scars. But it's not just that hands-on approach. It's looking holistically at the whole person to see how they're functioning and feeling, how they're moving, how they're coping with the scar. I also provide many different scar products as well in my clinics, ranging from honey-based products to the all-important silicone scar pads, which I use on a regular basis. The silicone helps protect over that scar and almost help keep in that moisture under the surface, so the scar is protected, so you don't rub it or catch it, but also it can lock in that moisture and that healing underneath the surface. There are different tapes that I use to help as well encourage scar healing, and also the silicone gels that I use as well. So it really is a complete, in-depth and full assessment and treatment of you and your scar. So if you'd like any more information about scar therapy and if it can help you, by all means email me at hannah@hlp-therapy.co.uk or send me a message through one of my many social media channels, HLP Therapy, and I look forward to answering your questions and helping you and your scar on your recovery journey. So take care and see you soon. Many thanks. Bye-bye.